Hello, and welcome to the 2019 Beneflex Benefits presentation. Today we're going to discuss the changes to the health plan for 2019 and some other benefits that are available to you. Annual enrollment is online through the Risk Management webpage or through employee self-service. By now you should have received your 2019 newsletter that has all of the information about what's changing for 2019. Today we'll focus on some of the changes for 2019, including the change from Humana to Aetna, including the prescription drug plan and the Aetna Health Promise Wellness Program. In addition, Teladoc will be replacing Doctor on Demand in 2019, and Healthcare Blue Book is getting some enhancements that will enable you to go green to get green. Before we discuss what's changing, let's talk about what's not changing for 2019. The dental and vision plans remain unchanged, and the life insurance is still available through the standard. Sun Life Disability still offers short and long-term disability, and you can get the hospital indemnity plan through MetLife as a voluntary benefit. Remember, if you do not need medical insurance, you are eligible to use a $75 per pay period board credit to enroll in some supplemental benefits. When we talk about the health plan, it's important to understand that our health insurance costs are the second highest expense of the district's operating budget. In 2019, the district's overall plan is projected to cost approximately $130 million. The district is contributing overall nearly 78% of the total costs for active employees. In early 2018, faced with rising healthcare costs, we requested our benefits consultant to market our health, flexible spending, and wellness program for administrative services. Together, we reviewed provider networks, administrative costs, and other critical factors for best pricing and access for our members. Based upon the results, Aetna was selected for our health plan administrator for 2019. We were able to reduce our expected premium increase from 9.3% down to 4.5%, and most of this increase is being absorbed through the additional board contribution. Let's talk about some of the health plan information. There will be 3 medical plans for 2019. They are similar in design to Humana, the Aetna Select Open Access Plan, the Choice POS2, and the Consumer Directed Health Plan. All 3 plans have national networks, and we anticipate a 98% physician match. If you are looking at the Aetna Select Open Access Plan, you'll be pleased to know that you're no longer required to select a primary care physician, and referrals are not needed. If you are enrolled in the Consumer Directed Health Plan, and you choose the Aetna Consumer Directed Health Plan, any funds on your personal care allowance will roll over to an Aetna healthcare reimbursement account. And another change for this year, dependent children will only be covered through the end of the calendar year in which they turn 26. Employees who do not log in will be defaulted into an Aetna medical plan for 2019. If you're enrolled in the HMO staff plan, you'll be defaulted into the Select Open Access Plan. If you're enrolled in the Humana NPOS plan, you'll be defaulted into the Aetna Choice POS2. And if you are enrolled in the Humana Consumer Directed Health Plan, you will be defaulted into the Aetna Consumer Directed Health Plan, and your funds will roll over to the Healthcare Reimbursement Allowance. So which health plan is right for you? Here are some things to consider. All the plans cover the same thing. The differences are in the per pay cost and what you pay for services. On the Select Open Access Plan, you do not have to meet a deductible. Remember, no PCP is required and referrals are not necessary. On all 3 plans, your preventive care is covered 100%. The Choice POS plan is the only plan with both in-network and out-of-network coverage. You must first meet a deductible of $500 for an individual, $1,000 for a family. After you've met the deductible, the plan will pay 80% and you'll be responsible for 20% of the negotiated rate. On the Consumer Directed Health Plan, you also must meet a deductible of $1,500 for an individual, $3,000 for a family. The plan would then pay 80% and you would be responsible for 20% of the negotiated rate. The Consumer Directed Health Plan is the only plan with a health care reimbursement allowance provided. Along with moving our health plans, we'll also be moving to the Aetna prescription plan in 2019. Medications will be covered under the Premier Plus Open Formulary. All generic medications will be covered under a $20 copay, including medications that were previously considered Tier 2 or Tier 3 drugs. If you take a medication that requires pre-certification or step therapy, that provision will be waived if you get your refill within the first 90 days of coverage. This option is not available if you take a controlled substance or other specialty medications. A big change to the prescription plan for 2019 is the out-of-pocket maximum. Previously, the out-of-pocket maximum was a combination of your medical and your prescription coverage. $6,250 for an individual, $12,500 for the family. In 2019, you'll have separate out-of-pocket maximums. This means that your prescription out-of-pocket maximum of $1,750 for an individual or $3,000 for a family could be met before you reach your medical out-of-pocket maximum of $4,500 for an individual or $9,000 for a family. It's important to remember on the Aetna prescription drug program that you can fill your prescriptions at any retail pharmacy. Most of the retail chains are in-network, including CVS, Walgreens, Sam's Club, Walmart, and Publix. There is no out-of-network pharmacy coverage, however, so you want to make sure that you see an in-network pharmacy for your medications. The 90-day supply for the cost of 2 copays is still in effect. This means that you can get 3 months for the cost of 2 copays. That is not available on specialty drugs. Drugs are categorized by type: generic, preferred brand, non-preferred brand, and specialty. For generic and preferred brand drugs, there is no deductible. You pay the copays as soon as you start to get prescriptions filled. On non-preferred brand and specialty medications, you must first meet the deductible of $250 for an individual, $500 for a family, before you begin to pay the copay. In 2019, Teladoc will be replacing Doctor on Demand. Download the app to any mobile device or laptop, and you can see a doctor 24 hours a day, 7 days a week. It's a $25 copay for all plans, so it's a great alternative to urgent care or if you're traveling and need treatment right away. Healthcare Blue Book is a great resource that has been available for the past couple of years. It allows you to search for a fair price provider if you need a test or a procedure. If you use a fair price provider, you can receive a cash reward up to $200 depending on the procedure. In 2019, we are adding more procedures and higher rewards. Keep in mind that you must log in and search for the procedure in advance in order to receive the reward. Another way to save money in 2019 is by using a flexible spending account. A healthcare flexible spending account allows you to set aside your own money to use for medical, dental, and vision expenses. The entire amount is advanced to you on January 1st and then paid back through payroll deductions. This is a great way for you to set aside money to pay for eligible expenses. You can use Dependent Care flexible spending to set aside your child care expense and save on your taxes. Keep in mind, both accounts are use it or lose it accounts, so be careful when you budget. Annual enrollment is your opportunity to choose between 2 dental plans. We will continue to offer the Humana Advantage Dental Plan and the MetLife Preferred Dental Plan. The Humana Advantage Dental Plan works like an HMO. You stay in-network and pay copays for all of your services. The MetLife Dental Program gives you access to both in-network and out-of-network dentists. Your preventive care is covered 100% on both plans. There will be changes to our wellness program for 2019. Humana Go 365 ends December 31st. Redeem your bucks by December 31st. If you've reached silver status by August 31st, you will get the wellness credit in 2019. Any status earned after August 31st and through December 31st will not count for 2019, but you will still be able to earn points and bucks. Make sure you spend them all by December 31st. Details are still being worked out for the Aetna Health Promise. More information will be coming. We will continue to offer wellness programs at each school site through the Wellness Champions. Aetna Health Advocate remains our employee assistance provider. It's free for employees and members of their household. There's great information online for continuing education and some classes that are offered for Certificate of Distinction or Educator Continuing Education. Remember, you and your family members are eligible for up to 8 free counseling sessions in person or online. Not making changes? You should still log in and review your elections. This is your one opportunity per year to log in and make sure that you have the right dependents on your plan, that you have the right coverage for yourself, and that you review your beneficiaries. Be sure to print or save your confirmation for 2019. Some helpful reminders for annual enrollment. Your changes can be made online October 24th through November 5th. Be sure to review your health plan options and your beneficiary information. Confirmation notices are available online. Be sure and print or save one. If you stay in the Consumer-Directed Health Fund, your allowance will roll over in 2019. Flexible spending funds are available January 1st. Take advantage of the no health option if you do not need medical insurance. For additional information, you can visit our website, contact the Aetna Concierge Service, or contact the benefits team at Risk Management, Monday through Friday, 8 to 4:30. So remember, if you have any questions during annual enrollment, contact the Aetna Concierge. Visit your Aetna custom website at aetnapcsb.com or contact Risk Management.